deaths. The physician to U.S. President Donald Trump says the president is doing well and has not experienced difficulty breathing. White House physician Sherwin Conley spoke at the Walter Reed Medical Center, where Trump is receiving treatment after testing positive for COVID-19. Dr. Conley said he cannot give a timetable for the president's release from hospital, but it is extremely happy with the progress Trump has made so far. The medical team, that is. The president was admitted last night.
As reported yesterday, in consultation with this group, I recommended we bring the president up to Walter Reed as a precautionary measure to provide state-of-the-art monitoring and any care that he may need. Just 72 hours into the diagnosis now, the first week of COVID, and in particular days 7 to 10, are the most critical in determining the likely course of this illness. At this time, the team and I are extremely happy with the progress the president has made. Thursday, he had a mild cough and some nasal congestion and fatigue, all of which are now resolving and improving.
And for more on this, we're joined by SABC News correspondent Sherwin Bryce-Pease, who's been keeping a close eye on this. So, Sherwin, let's talk about that. The president's doctor's painting a rather rosy picture. It seems that all is going well from what they've just told us. But what have you learned behind the scenes?
Well, the trust deficit, SABC, with this White House has grown since Dr. Sherwin Conley came and spoke. I mean, he talks about just 72 hours into the diagnosis now. We only learned that the president was COVID-19 positive on Friday morning at 1 a.m. He's now talking about a timeline that says the president tested positive around Wednesday, late morning, early afternoon. And of course, the president's schedule did not change. He continued with his campaign rallies in Minnesota. He traveled to New Jersey for a fundraiser where he was in close proximity at a round table with funders, 18 of them in a closed room, not wearing a mask as late as Thursday afternoon. So a lot of consternation here. Remember, if he was positive on Wednesday morning, this would have been mere hours after he concluded his presidential debate with Joe Biden. And right after Conley completed that press conference, that very brief press conference where he didn't answer all the journalists' questions, the White House pool report, essentially the select group of journalists that go and cover the president, all journalists don't go, they call that the pool report, issued this statement: the president's vitals over the last 24 hours were very concerning, and over the next 48 hours will be critical in terms of his care. We're still not on a clear path to a full recovery. And that's a quote from an anonymous source who is familiar with the president's condition. And so that really essentially contradicting the rather rosy picture put out by the president's doctors. Let's listen to Dr. Sean Dooley. He is the critical care physician who is part of this multidisciplinary team that is monitoring the president's progress.
He's receiving outstanding multidisciplinary care, the state of the science for coronavirus infection. We are monitoring him very closely for any evidence of complications from either the coronavirus illness or the therapies that we are prescribing to make him better. We have monitored his cardiac function, his kidney function, his liver function. All of those are normal. And the president this morning is not on oxygen, not having difficulty breathing or walking around the White House medical unit upstairs. He's in exceptionally good spirits, and in fact, as we were completing our multidisciplinary rounds this morning, the quote he left us with was, "I feel like I could walk out of here today," and that was a very encouraging comment from the president.
So that anonymous source, SABC, essentially contradicting what the president's physicians are saying that the next 48 hours will be critical in terms of his care. We have heard just a short time ago from the president himself tweeting. He says doctors, nurses, and all the great people, at the great Walter Reed Medical Center and others from likewise incredible institutions who have joined them are amazing. Tremendous progress has been made over the last 6 months in fighting the plague. With their help, I am feeling well. So You try and make sense of that. Very contradictory statements. The doctor's saying he's doing well. The president's saying he's doing well. A White House source saying critical in the next 48 hours.
And as you say, Sherwin, that contradictory statement, the source is saying that there's concerns around his vitals, but now also added to that is word that therapeutics are being administered, experimental drugs that have received approval from the FDA, but emergency approval.
Correct, including remdesivir. The Dr. Conley talking today about how the president received his first dose of remdesivir, an intravenous antiviral drug shown to shorten hospital stays associated with the coronavirus. Yesterday, Dr. Conley put out a more formal statement talking about how the president had received a single 8-gram dose of Regeneron's polyclonal antibody cocktail, essentially an experimental antiviral cocktail. And so when we talk about antiviral drugs, Tsepiso, it's essentially to counter the virus, right? You're in a race basically to support the immune system. And so these antiviral drugs, these experimental drugs, 2 of them have now been administered to the president since Wednesday, which I think really speaks to the urgency and the concern around his condition. Remember, initially the statement from his doctor said he would be convalescing within the White House precinct. That very quickly changed within 24 hours when Marine One landed on the south lawn of the White House and took him, transported him to the military hospital close by. Dr. Conley also spoke about when the president might or might not be released, and this is really instructive. Let's watch.
It's important to note the president's been fever-free for over 24 hours. We remain cautiously optimistic, but he's doing great. I don't want to put a hard date on that. He's doing so well, but with a known course of the illness, days 7 to 10, we get really concerned about the inflammatory phase 2. Given that we provided some of these advanced therapies so early in the course, a little bit earlier than most of the patients we know and follow, it's hard to tell where he is on that course. And so every day we're evaluating, does he need to be here? What does he need? And where is he going?
So he is a high-risk category. Remember, 74 years old, medically obese, has an underlying condition, cholesterol, and a slight heart ailment for which he takes aspirin every day. And so very high-risk category. The doctor talking there about the inflammatory phase, the 7 to 10-day period that they're going to watch very closely. And remember, we're only in day 3 here. So a lot of unknowns here in terms of the contradictory statements we're getting out of the White House.
Another thing that we spoke about, Sherwin, yesterday was about the people who he would have come into contact with and what would this mean in terms of the contagion levels. But I think what has also become interesting, people are asking, the fact that he has disclosed that he was COVID-19 positive, was that incidental, or was it because of the mere fact that he came into close contact with so many people that he works with at the White House that it could not have been ignored? It could not have been disclosed?
It was not disclosed. It was a leak. It was a media leak that discovered that Hope Hicks, the close aide to the president, had tested positive for COVID-19 on Thursday. And that's when speculation became rife as to how deep this went in the White House, given her close working relationship and her regular close proximity to the first couple, to the first family, traveling wherever he goes on campaign stops, was at the debate with him, was in Minnesota on Wednesday with him. And of course, the president's schedule did not change, despite, as we are learning now from Dr. Conley, that he was diagnosed on Wednesday, and so kept this secret and away from the American public, and continued to with his events, not wearing a mask, not social distancing. And we are hearing from some of those donors in the New Jersey event on Thursday that they are very angry that they were not informed that the president knew that he was infected. And what we are now seeing, Tsepiso, is a number of senior government officials, including a number of Republican senators, that had had been in close proximity to people at the White House, including that Rose Garden event, that super spreader event on Saturday where 150 guests were let into the White House Rose Garden for the official nomination of President Trump's Supreme Court nominee to replace Ruth Bader Ginsburg. A number of people that attended that event, including a Republican senator from Utah, a Republican senator from North Carolina, Kellyanne Conway, who was there, the former aide to the president who has helped him in his debate prep. She has now confirmed that she's COVID-19 positive. And the latest diagnosis we received earlier today was the former governor of New Jersey, Chris Christie, who has also played an important role in the president's debate prep. He was with the president in Cleveland, Ohio for that debate. He today revealing that he is also COVID-19 positive. Contact tracing is going to be extremely important now. A minimum of 150 guests at least at that Saturday event. Who knows where this goes? We are at the beginning here of a major scandal in the White House in terms of how this president and his White House handled his diagnosis, as we are learning today, as early as Wednesday, Tipiso.
And a final question, Sherwin. Obviously, the optics of President Donald Trump falling ill in terms of COVID-19 could prove, I'd imagine, rather damaging to his campaign, given the fact that he has spoken on so many occasions how, as you said, that the disease would just disappear. And as you mentioned, his advisor, Hicks, who's a very important communications person. So just talk to us about the symbolism of all of this.
Well, there's a sense that there was a cavalier approach to how this was handled because the president has been on the record, as we well know and have been in conversation for months, that this virus was going to go away, that it wasn't as bad as people were making it out to be, and that the economies and schools should reopen because, you know, that was far more important than the public health emergency. And so what has happened to him here, the humiliation of having to walk out of the White House wearing a mask, which he has refused to do on countless occasions, and having to take a helicopter to a hospital is really a climb down from what we have come to learn of this president over the last number of months, particularly as it relates to this pandemic. So this will be a gut-wrenching blow to the narrative that this White House seeks to put out just 30 days before this election. They are going to either have to completely rejig their communication strategy in terms of the wearing of masks and highlighting the public safety and mitigation efforts that are so well known, but have not really been enforced from the top. So this is a game-changing moment in this presidential race for a president that was already lagging by an average of 8 points nationally and in a number of battleground states. So this is an advantage for Biden in many ways, but really, I mean, a humiliating day for the president, a humiliating few days for this president, certainly.
And just a final question on the practicalities of what is happening at the White House. I'd imagine that White House staff is eating at the cafeteria, White House staff is having to go into the White House. Is there at least some trepidation? Is there a major show of, sanitizing the White House, making sure that people know that the right thing is being done? In other words, sending a message that there is acknowledgement that it can be a danger, and a serious danger to other people's health.
I mean, I'm smiling because it's a simple answer. The White House is going through a deep clean. I mean, that's just a fact. We saw for the first time a group of White House aides that were waiting on the South Lawn before the president walked to Marine One, before he went to Walter Reed, and everybody was wearing a mask. And that is not a scene you have ever seen at the White House. Every day they got testing at the White House before they started their day. They thought that was the blanket, that was the bubble. And what we have learned now is that even if you get tested every day, that is not a silver bullet to keep COVID-19 out. That's wearing a mask, washing your hands, and social distancing. So, in short, it's a deep clean at the White House.
Well summed up. Thanks a lot, Sherwin. Bryce-Pease, SABC correspondent in New York, keeping us up to speed on those headlines coming out of there. The condition of President Donald Trump after he spent his first night in prison. You've heard the medical team saying that he's in good health, but it would seem, or rather in hospital, but you've heard some say that the contradictory remarks may be that there's concerns around his vital signs. But of course, Sherwin will continue keeping us up to speed. Now,